for the mothers. You gotta love the mothers. And you gotta hug the ones who bring us joy and love. It's the middle with the moms and it's your day.
Ayo, what's up, guys? It's Camilla. Haven't been on here in a hot minute. Now that I'm finally getting caught up, it's time to release another amazing episode. Beyond excited for y'all to listen to this one. I talk about her in, I really think, every single episode I've posted so far. But it is Dr. Alicia Wright, and she is my OBGYN. She's absolutely amazing. I recommend her to everyone. I think all of my friends go to her and family members, which is hilarious. I love it. She's just not only an incredible doctor, but she's an incredible person, an incredible mom, wife, and just a honestly complete badass. I'm so thankful to have her as my OB. I don't know what I would do if we ever moved out of the Memphis area. I don't know. I could not live without her, especially if, well, you know what? I was going to say if we have another kid, but pretty sure this is our grand finale, but still. She's delivered both of my babies, and I'm so thankful to have had her during that experience, because it's so beautiful and such a wonderful experience. But of course it is scary. And so having someone who is good at their job, loves their job, so informative and confident, it's just a really good feeling. And the type of support she gave me through both deliveries is the exact type I need. So thankful that she did this podcast with me. Hopefully you learn as much as I did. In this episode, I had a subchorionic, I think that's how you say it, hemorrhage. And I do just want to say it did resolve itself. I am so lucky and blessed that it did, because I could not imagine being on bed rest with my wedding schedule, with 2 children. Oh my Lord, 2 babies. But anyway, it did resolve itself. So thank you to everyone who was praying for me and this sweet baby. And I'm so excited for y'all to hear. Sorry I'm talking so much. Okay, bye. Okay, you ready?
I'm ready.
Okay, hello.
Hi.
Welcome. I'm so happy that you're here today. We finally get to do this. Really? Oh shit. Okay. Redo. Okay, hello. Welcome.
Thank you.
I'm so happy that you're here.
Me too.
That you're finally here. Me and you are connected in so many ways.
So
And
many.
I am just so thankful that I have you in my life, and that you have helped birth my 2 children. Hopefully this third one will come out pretty smoothly. But yes, I'm just so happy you're here. And I want to introduce you, everyone. Finally, Dr. Alicia Wright is in the house. And we go way back, obviously.
Way back.
Our moms are best friends. And they were part of this cute little group of 4 women. And which is funny because you are too, right? Don't you have a group of like 5 of y'all?
I have a few small groups.
Yeah.
But yes.
Yes. I thought that was funny though, because
Yeah.
I'll see you like post pictures with them, and I remember them from like your bridal shower.
Yes.
I'm like, they're still friends and have kids
Yes.
together. So cute.
Yes.
But yeah, so those 4 women were all pregnant at the same time. So have all 4 of us at the same time. You were already born. You're the older one in our little group.
Yes.
But you got to hold me when I was born, probably. I'm pretty sure your mom filmed my mom giving birth to me.
Yes. And your mom was at my brother's birth.
Really? That's so funny. So yeah, connected in that way. We both went to St. Agnes. So a lot of mutual friends there. But yeah, so.
And I taught you.
You taught. Oh yeah. Oh my God. I was like, you taught me.
Isn't that crazy?
You took Mr. Rousey's place.
I did.
Oh, have I got a story about Mr. Rousey?
The very great pleasure of teaching.
Yes. That's so funny.
guys.
You were doing math.
Yes. Yeah, exactly.
That is so funny. How was that for you?
And then my wedding too. Don't forget about that.
Oh, yes. Okay, so I was in 8th grade when you got married, as weird as that sounds. And
That is so weird.
Really, it's
Baby.
really weird.
Yeah.
But I remember it like it was yesterday. I remember the dress I wore. I looked like a clown. I don't know why my mom let me wear that. But I brought my mom's crappy little camera, and I like randomly would film it throughout the ceremony. I took pictures. I followed y'all with Russell Hayes, your photographer, around downtown, took pictures. That was technically my first wedding ever in 8th grade.
I love it. It's my favorite.
Good. Do you still have that video?
Yes,
You do?
yes.
Oh my God, I got to see that. That's
I know.
hilarious.
I know. We need
probably
to get it
so
out.
bad, but at least you have something.
Yes.
But yeah, so that too.
I always tell people I was your first wedding.
That's so funny. Oh my God. I'm glad you just brought that up because last night I was like, I got to say that and I almost forgot. So, wow. So y'all how long have y'all been married now?
15 years.
15 years? That's so long.
Yeah,
Oh my gosh.
We were 22, I guess. 22
Yeah. Y'all were babies.
Yeah, we were babies.
Yeah. And now y'all have 3 beautiful children that are the cutest
They're not
things.
babies anymore.
I know, but they're your babies forever.
Yeah, forever.
Maybe I'll film their wedding one day.
I can't
I'll be like the old lady still doing weddings. God.
Please, I hope so.
I know.
Even if you come back into weddings out of
just to do
retirement,
it.
just for mine.
Oh, I will. You know I will. But yeah, so do you want to start off talking a little bit about yourself?
Yes, I would love to. So Patrick is my husband. We've been married 15 years. We were best friends through high school and college and started dating in college. Got married in our early 20s. And then I went to medical school and we had our first baby in medical school.
Crazy.
And then our second baby, so my oldest is a boy, and he's now in 6th grade, which just rocks my world. I can't believe it. And then my daughter is 8. I had her in residency.
Oh my gosh.
And then I had my third in private practice, and he's 5.
Lord, you were a busy woman, I'd say.
All the time. Always busy.
Oh yeah. And Patrick, wasn't he in school too?
He was in nursing school when I was in medical school,
Okay.
but he had graduated when we had our first, Declan.
Okay.
Yeah.
Did he get like a paternity leave? Because you didn't really get to take a break.
You know, for medical school, I did get some time off.
Okay, good.
So he continued working through that. Honestly, he worked with all of them. Because I got a short amount of time with each of them.
Okay, good.
So,
That's good.
Yes, I did get that,
Good.
thankfully.
And you had help too with y'all's
Yes.
parents.
Oh, yes. We both have parents here in town. So,
Which is awesome.
yeah, we have
Such
lots
a
of help.
blessing. So let's talk about your first pregnancy.
Oh.
What was that like?
Oh, my gosh. So I was a 3rd-year medical student. And 3rd year of med school is the first year that you're really doing your clinical rotations. So I had studied for the last 2 years, taken all my tests, taken my boards, and then got to get into the hospitals and found out I was pregnant pretty much right when I started that year. So unfortunately, I was extremely sick with my first. I had to take a month off of medical school because I was so sick. And I was on my pediatric rotation. So thankfully they were super understanding and amazing. But I took that month off. And then once I was back, I was feeling better. And in around 32 weeks, I started contracting all the time.
Oh boy.
Yes. And I was contracting regularly. And at 35 weeks, I went into full-blown labor and had my first at 35 weeks.
Oh my gosh.
Yeah, so 5 weeks before my due date.
Right.
Yeah.
And was he okay?
Yeah, he was fine.
And you were okay?
Yeah, he weighed 7 pounds, 7 ounces.
Well, maybe that's a blessing.
Yes. I was on my psychiatry rotation. So I was
wow.
at MMHI, which is a very serious inpatient psychiatric hospital.
Wow.
And I was walking out of the building that day and I started contracting and I was like, yep, today's the day. Like my gut, just like inside, I just knew it. So went home that night and slept through the night, kind of just waking up every once in a while. And then like at 3 a.m, woke Patrick up and I was like, I'm really hurting.
Oh no.
Which was such a surprise because I was 35 weeks.
Yeah.
You know? I mean, we kind of had a feeling it would happen early, but it was just such a surprise. With your first, you just don't know what's going to happen.
Yeah.
So went into the hospital and was in so much pain. And I mean, there was no going home. I wasn't really, I think I was like 1 centimeter and 100% effaced, but
oh my gosh,
I was just in so much pain that it was just like, there was no sending me home.
Yeah.
So I think I progressed to like 4 or 5 centimeters and then they started Pitocin and broke my water
and hopefully it was smooth sailing.
Oh yeah. Well, I say that. We look back on our births a lot of times as like these just amazing, happy experiences and we forget about how hard it was.
Yeah.
But I pushed for 4 hours with him.
Oh boy.
Yes.
Did you have an epidural?
Uh-huh.
Okay.
And then the doctor had to use a vacuum.
Oh, really?
Yep.
What did you think about that? Because you're about to be in this field. What did you think about that?
Well, I had fortunately had my OB rotation during my pregnancy.
Oh, okay.
So I had spent 8 weeks doing obstetrics and gynecology, and so I knew that was what I was going to do.
Okay.
So I was like pretty informed about that as a possibility, and so it didn't alarm me, and I was frankly just ready for him to be out.
Yeah. Why did they have to? Because his like heart rate?
No, he just, because I had been pushing for so long.
Yeah.
It was either we do a vacuum or you have to have a C-section because you've been pushing a long time.
Yeah.
You know? And I think it was because he was so big. And that's not big for some women's pelvis.
Yeah.
But for mine.
Yeah.
It was big.
It's big.
Yeah. 7'7" at 35 weeks was big for me.
Yeah.
My other two were 6'10" and 6'5". So I generally have
was so big.
small babies. Yeah.
He could have been like 10 pounds.
Yes, over 10 pounds at 40 weeks for
think,
sure.
is it possible to get a due date wrong or no?
So I know the day he was conceived.
Okay.
So there's no question. Yeah. Yeah.
How big was Patrick when he was born?
He was big.
Okay.
Him and his brother were both 9-10 pound babies.
Okay. And that makes a difference with your babies,
sure.
right? Okay. Some people say it's how your mom has babies. And I was like, no,
I think from a labor perspective,
okay.
A lot of times we do what our moms did. But from a size perspective, I've seen tiny women have huge babies because the dad was huge, or is huge, really tall or football players,
Oh yeah.
So.
Oh my gosh.
So then I also had a 3rd-degree laceration with him. So that
on its own, not like an episiotomy.
I think he cut an epies, but it extended to a 3rd degree. So, and that is, for those who don't know, that's from the vagina to your bottom.
Yeah.
It's a tear.
All the way?
Yeah. Well, so it's not all the way, but it's right to the muscle and into the muscle that supports your bottom.
Yeah.
So that recovery was really hard.
Oh, no. Yeah. That's scary.
I know. It was rough. Rough. Postpartum was great. He came home with me. We breastfed. And then during the pregnancy, I had developed a hernia. And I had to get that repaired while I was on maternity leave because I didn't know when the next time I would have time off to get that done. So when he was 2 weeks old, I had surgery to get that repaired. And then unfortunately quit breastfeeding after that.
I was going to say, would you even be allowed to?
Yes, you can. But I was just so overwhelmed with all of it. And I wish that I had continued breastfeeding. But, you live and learn.
Yeah.
And I went back to work, quote work, at 8 weeks.
Okay. So, that's good.
Yeah.
That was nice.
I got 2 months off. Yeah, it was great. Awesome. Yeah. And it didn't extend my schooling at all.
Okay.
So that's great.
Yeah, that's really good. So he didn't have to even see the NICU or anything?
He went to the nursery for a few hours.
Okay.
Just for temperature control and breathing control, just to make sure he was good. But he was with me within a few hours.
Oh, no. How was that? You've probably already birthed babies, being there. So how was that? It being your baby?
Amazing. I spent my life knowing I wanted to be a mom.
Yeah.
And that, just that moment is there's just nothing like it, I know. I'll never forget our first night in the hospital. I woke up ball crying. We had sent him to the nursery just so we could get a little sleep because the labor process was so long. I woke up ball crying and I was like, what is happening?
Yeah.
Why am I crying?
Yeah.
And all of a sudden I hear him crying coming down the hallway. And it's like,
oh, I got the chills.
I know. And then the nurse opens the door and they're like, okay, he's hungry. And it's like, golly, your innate nature to be a mom just kicks in the moment.
Connected to him.
Yes.
You felt it. That's so special.
I know. It's so sweet.
I got to hold him when he was really like a newborn. I remember something was going on, some kind of party or shower or did y'all have a sip and see? It was something. I think it was at Patrick's parents' house.
Maybe.
I don't remember what it was.
So I went into labor the day of my baby shower. So I came home from work that Friday night after work. And then that morning I was supposed to have my baby shower that day.
So you never had
I never had a baby shower. No. So I tell my patients now, like, schedule your baby shower early. Like 32 weeks, because you never know. 36 weeks is not a good time to have a baby shower, because you never know.
Yeah.
Yeah.
That's so funny.
So I had lots of visitors in the hospital because so many people were going to come to the shower.
Oh,
and
I bet.
Yeah.
Was that overwhelming for you? Did you like it?
No. Looking back, like, I was like, that was too much. We were exhausted.
Yeah.
Exhausted. But we got pedophores at the hospital.
That's hilarious.
So we had a huge box of pedophores that were supposed to be for the baby shower. Yeah. That's what we ate for like 3 days.
Did you get to open presents?
Yes. People brought the presents.
Was that overwhelming?
No, that was fine. Presents are always fine. Yeah,
for the babies. Yeah. Oh, well, he was so cute. I remember, like, I mean, before you have kids and when you're young, you have no idea, like, how hard, like, being pregnant is or being a mom is. But I remember, like, holding him, and I just remember him, like, me not holding him that long. I don't know if it's your mom, but just so protective. And I'm like, that is me now with my children. Like, I'm like, you get 5 seconds, or I'm like, you can't touch them.
Yes.
But how was your postpartum? Like,
yeah, I had really bad postpartum depression.
You
with
did?
him.
I didn't know that.
Yes, which was a really big surprise.
Yeah.
I've kind of struggled with anxiety, you know, just mild anxiety a long time, but I think that, so he was super colicky.
Oh, really?
And then just like the lack of control. I had always just very type A personality.
Yes.
My life was always well controlled, well planned,
organized.
Yes. Everything was just how I was going to arrange it all the time. And a newborn just rocks your world.
Yeah.
You know, lack of sleep, lack of a schedule.
Yeah.
And then you add in a really fussy baby.
Yeah.
And it just is the perfect storm.
Yeah. How long were y'all married? Like when he was born?
5 years.
5 years. Oh, that's good.
Yeah.
That's a long time. So y'all
maybe
had
4 years.
Y'all had a really strong foundation going in.
Oh yeah.
That's good.
Yeah. And we had already been through 2 years of medical school. We had been through nursing school together. So yeah.
That's good.
So I was on medication with him probably 6 months.
Okay.
Just to help with postpartum depression. And then I was fine.
Yeah. How did you know you had it? Just because of the field you're in?
So my 6-week postpartum visit, I bawl cried the entire time. And my OB,
I did that with you too.
was like, you got to do something.
Yeah.
Like, you can't live this way.
No. Yeah. And you, like, for me, I remember when I came into my appointment with Chessa, oh my gosh, I like filled out the little paperwork and you like came in the room and you go, this is not good. You were like, let's figure something out. Yeah. And that's when you were like, let's talk about medicine. But I was so like, I don't need it. I'm going to get over this. And oh, do I regret that? I mean, I guess I don't regret it. I'm glad I learned from it now, because now I'm on some.
Right.
But you don't think that's going to happen to you. And also, like, I had no idea what postpartum depression was. And I heard of baby blues, but I think on like TV shows or something, like postpartum depression, like it's like really bad for moms. Like if I watched like a show like Medium or something, like the postpartum depression mom's like
is severe,
killing her kids or something.
Right.
And so when I was like, I have that, I'm like, I don't feel that way. So I'm just like total denial, but it's not that.
No, and it's so common.
Yeah.
I mean, gosh, I think at least over half of my patients struggle with some form of baby blues. I mean, or depression.
Yeah.
And postpartum anxiety is important to know about, and postpartum OCD. I mean, that is a big one.
Gosh, I think I have all three. I never heard of that one. What's that one?
I mean, it's like OCD symptoms, you know, that are exacerbated or just show up during the postpartum period.
Yeah.
Particularly people like me, who kind of are type A, probably OCD, you know, that's what gets really bad.
Right. Did that happen with you? Yeah.
Yeah.
Well, let's talk about your second pregnancy. So now you were in residency.
So, let's see. I was a first-year resident, finishing up it was like February of my first year, and we decided we wanted to have another baby. Declan would have been 2 in March. So we started trying in February and got pregnant. We were doing November. And and residency is very different from medical school. Medical school, very structured schedule. You know, pretty much 8 to 5. Some rotations were harder, but for the most part, it wasn't terrible.
Yeah.
Having a baby in residency is a whole different story.
Okay.
You know, the work week for a resident, the expected number of hours is 80 hours a week.
Ooh.
And a lot of times it's over that.
Yeah.
So, I mean, I was working like a dog.
Yeah.
And it was probably the hardest thing I've ever done, was being pregnant during that time.
Oh my gosh. You're so tired already.
Yes.
You already have a baby at home.
Yes.
Oof.
Yes. And I was sick too. I mean, I wasn't as sick as I was with Declan, but I was sick.
So your first trimesters, you're usually not
Really
feeling
bad.
so hot.
Yeah. I'm taking medication around the clock.
Like Zofran or, okay.
Exactly. Yeah. Then I started with the contracting again, you know, so 31 weeks, I think.
And
with
like,
her.
are you talking like legit contractions or Braxton
Oh yeah.
Hicks?
Like if I put myself on the monitor, I was contracting.
Oh my God.
But you know, not significant cervical change,
Yeah.
but just uncomfortable
Yeah.
and just, you know, and so I ended up getting admitted at 32 weeks with her to stop the labor because it was like the real deal.
Yeah.
And then I was on bed rest with her for 4 weeks.
How was that? Like legit, like you can only pee bed rest?
Well, it's not that extreme. Bed rest isn't a great term.
Okay.
It's really like, I'm going to get real scientific here.
Okay.
But the studies don't show that bed rest is the preferred modality for decreasing preterm labor.
Okay.
Really decreasing stress has been shown to improve outcomes.
Oh, I'm sure.
So for me, that's what bed rest looked like.
Okay.
So I quit working.
Yeah.
I was, you know, stayed at home, you know, pretty much just rested.
Yeah.
And, you know, I didn't go to the grocery store. I didn't go on trips to Target. Like just stayed at home and piddled around the house, but nothing crazy.
Right.
So then on 36 weeks and 6 days was Halloween. And the next day I was full term. So I went trick-or-treating.
Do you remember what Declan was dressed up as?
Oh yeah. We dressed up together. You know, we do family
You always
costumes.
do that. They're so cute.
Yeah. So he was Peter Pan.
Oh.
And Patrick was Captain Hook and I was Tinkerbell.
Okay. I think I remember these.
So we went trick-or-treating that night and I went into labor. And had
How far did you walk?
I mean, you know, normal trick-or-treating. He was 2.
He was 2, yeah.
It wasn't like it was crazy.
Yeah.
And then so had her the next day.
You had her the next day?
37 weeks. Yeah.
Oh my gosh.
Yeah.
So her birthday's coming up.
November
Aw,
1st.
That's
Yeah.
so cute.
Yeah. And she was an easy delivery.
Good.
So easy. 6 pounds, 10 ounces. She came home with us. She was born with one of her eyes swollen shut.
Oh my gosh.
And it's a congenital blocked tear duct.
Okay.
And so it like had swollen and closed off her eye. So we had to deal with that when she was born. And actually at 2 weeks old, it became infected.
Oh.
And she had to be admitted to Le Bonheur. And we were there for like 2 or 3 days.
Oh, wow.
Getting antibiotics. And but other than that, the postpartum period was easy. I actually made the decision to start medication the day she was born.
Okay.
To
Good
prevent
Yeah.
postpartum depression.
Yeah.
Because I didn't want to do that again.
No. So when did you get off your medication after Declan was born?
Probably about 6 to 8 months,
Okay.
I would say.
That's good. So you just kind of got to wean off of it.
Mhm.
How did you know you were ready?
He became so much easier.
Yeah.
He was just such a hard baby.
Colic?
Yeah, he was so hard. And so I just, once he stopped crying all the time, really that kid cried all day, every day until the day he learned how to crawl.
Oh my
And so he was about
Poor
8 months.
angel.
I know. So once he was on the move, he was happy.
Yeah.
And at that point, it was kind of like, oh, I can take a breath again.
Yeah.
You know.
And colic, like that is like gas in their tummy, right?
So it's a little bit controversial.
Yeah.
There's not really a cause for colic.
Yeah.
Like we try to find one
Mhm.
because we want to fix it.
Yeah.
But it's just some babies just are fussy.
Right.
Yeah. And it may be that he needed more time inside my uterus.
Yeah.
You know?
I'm sure Raylan he did not want to come out.
Yeah.
Yeah.
So,
okay. Well, I'm glad that you knew, well, obviously you're a doctor, but I'm glad that you knew you needed to get on that, like the day after she was born to prevent that. And that worked, obviously.
it was great. My postpartum with her was amazing, except for the fact that I had to go back to work at 4 weeks. So,
At 4 weeks because you were in residency. Oh,
and because I had taken time off when I was pregnant.
Oh yeah. 4
So
weeks.
I didn't have much time with her, but I think taking those 4 weeks off while I was pregnant was worth it for my mental health.
Oh, of course.
Because doing all of that was really hard.
Oh yeah.
Yeah.
How was that for you leaving her? Did that affect your postpartum? Yeah.
Yes. I would say it was harder with her than going back to work with Declan.
Yeah.
She was such an
She's so
easy baby.
little.
Yeah. She was such an easy baby, and fortunately we had family that was willing to keep her while I was at work, and so
Thank goodness.
yeah.
How was it being at work all those hours and coming home with 2 kids?
Hard.
Yeah.
Yeah. Back then we would do 6-week rotations where we would work nights only. And so I would work a night, so from 6 p.m. to 7 a.m. and then come home, say hi and bye to my kids, sleep during the day, and then say hi and bye to my kids, then go back to work. So, I mean, I have periods of time, particularly with Isla, that I don't even remember her being a baby, you know?
Yeah.
Because, I mean, I look back on it. I'm so glad I did it when I did.
Yeah.
But there are things that make it really, really hard.
Yeah.
Yeah.
And I know.
And everybody has their own hard.
Yes.
You know, I mean, that just was my life and what made it hard for me.
Yeah.
And everybody has their own hard.
Oh, absolutely. I mean, I'm still having a hard time. I'm trying to take the word balance out because people are telling me there's no such thing as balance. And I'm trying to give whatever I'm doing, my all to whatever I'm doing. And so me trying to work at the same time as being with the kids, I really just can't do that anymore because it's killing me. And then I feel guilty. So, I have a hard time. Yeah.
Boundaries.
But I'm glad that you came home and slept. Because my psycho ass would have been I'm just going to stay up. And then I would have lost my mind. So I'm glad you slept.
Yes. No. Well, and they were also at school. I mean, in daycare and at school. But I have honestly always had pretty good boundaries with my mental health and my physical health, you know. I mean, it's important if we want to be good moms, good wives, good doctors, good whatever it is you do in your life, then you've got to have boundaries and keep yourself a priority.
I know, because we're not superhuman, even though you always, everyone probably thinks they are.
Yes.
But I texted you, I don't know, last week or something, or 2 weeks ago. And I was okay, this is embarrassing for me to say, even though I know it shouldn't be embarrassing, but I am not being the best mom that I can be because I don't know. I wanted to ask you this. Is there such thing as being pregnancy depression or pregnancy anxiety, or is it just
100%.
carried over? Because
I see it all the time. Yes. My patients who have at baseline anxiety or depression, I'm constantly reassuring that this can get worse in pregnancy and that's okay. I mean, you've always said that you feel your best when you're pregnant, but
I know that's why I'm so confused because after Chessa was born, the depression was so bad. And then I got pregnant with Raylan and I was oh, I'm a new person. So I'm just gonna be pregnant all the time. And then now, oh my gosh, after Raylan was born, I thought I'm not gonna get it again. Well, I did, but I got anxiety as well. Yeah. I've never had anxiety in my entire life. And after Raylan was born, wow. Yeah. And I definitely think I have the OCD thing. Yeah. But now that I'm pregnant again, I feel really depressed and but it's weird. It's a roller coaster. I'll be super happy one day. Today I feel amazing. But
good timing.
Yeah, right. But some days, when the kids are both crazy or screaming, just being kids, normal kids, I can't handle it. And I'm I don't want to scream. I don't want to be a horrible mom. So wait, I'm stepping outside. But sometimes I don't have an option to do that. So I would like to be able to relax. And sometimes you can't control that. I'm glad I'm aware of it, but it's so hard.
But also you're in the thick of raising babies. Being in the thick of raising babies, it's hard. Yeah. I mean, babies, toddlers, pregnant, that is the hardest time.
Yeah.
And I say that, but mine right now are kind of in a sweet spot, and I'm about to have teenagers. That's probably really hard too. So I'll let you know.
Yeah, I can imagine. Yeah.
But just I look back on my babies being babies and just think about like I don't even know how we survived it.
I know.
I mean,
you don't think about that until you have kids. I'm like, how did my parents do it? Like it looked like they did it so easily. Yeah. And so I'm like, wait.
Yeah. Last night, Patrick was scrolling through old videos and pictures from when the kids were really young, and we had it like posted on the TV so the kids could see it. It's so fun. They loved it. They enjoyed it.
It's so important. That's why I should always video.
Yes, and we got to a video of Fitz was 1, so my baby was 1, and so the others were like 3 or 4 and 7, and he was walking through the house with a camera, and I'm like a very clean person, like. Yes. My house better be clean or my mental health is not good.
I literally in the same way. That's why I think I have OCD.
Yes.
Like I look over there, I'm like, I'm not going to look over there.
And he videoed the house, Camilla, dishes like to the ceiling, laundry everywhere, toys everywhere. My kids were like, what? We lived like that? Like they couldn't believe it.
How did it make you feel seeing that?
Terrible. I'm like, no wonder I was so stressed.
Yeah.
Like, I mean, number one, you're doing a ton of laundry because your kids are babies and they're messy.
Oh my gosh, so much laundry. It's insane.
So much laundry.
Oh man.
So much laundry. Yeah. And so much dishes. And you're just in the thick of it. It's it's a hard time.
As my friend Tori says, we're just surviving. Right
Correct. Yeah. And I feel like I want to tell the world, like, it gets easier.
Yeah.
I promise.
Yeah.
Because I forgot how hard it was.
Yeah.
And then that video, I was like, whoa, we used to be like that.
Yeah.
But it does get easier.
Yeah. And the thing that I think I struggle with is I'm so obsessed with being pregnant. I'm so obsessed with having a baby. Like I just love it. And like, I feel like my life just flew by, especially when you have kids, like time goes by faster, I feel like.
Absolutely.
And I do not want it to fly by. No. And so I'm like going through the hardest time ever, but like I want to enjoy it too.
You want to savor it.
Exactly. Yes. That's why I'm also like, I have anxiety about having anxiety. So I'm like, I got to get that under control because I want to enjoy every moment, even though it's hard.
Yeah.
So hopefully this medicine kicks in.
Yes, it will. You're going to feel great.
So then let's talk about Fitz.
Yeah, the baby. Yes. Always the baby. So we decided when Isla was 2, to start trying for him.
Great spacing. Spacing.
2 years is my favorite.
Good.
It's I know.
I haven't learned that one yet.
It's all right. I'm glad for it.
Yeah.
I get to see you
I
more.
know.
So when she was 2, we decided to have our 3rd and probably final baby. So we became pregnant with him in February again, and no, maybe March. We became pregnant with him in March and then due in December. And another hard pregnancy, but definitely my easiest one.
Okay.
I was very sick with him at the beginning. And at that point in residency, we had started 24-hour shifts. So 24 hours on the labor hall. Fortunately, I was a chief resident, which means that my direct responsibilities were not as important, but supervising was basically my job, and just being available for emergencies and that kind of thing.
The only reason I know what that is because of Grey's Anatomy.
Yeah.
You were Chief Bailey, right?
No, she's an attending.
Oh, okay.
Maybe
in the beginning.
Maybe,
I don't know.
Yes. I think she was a chief resident in the beginning.
So you watched that show too?
No, not anymore.
You did though.
I did before medical school.
Oh, and you had to stop because it was so bad and false. Okay, I know. I'm like, I know about that, but I'm like, no, it's probably wrong.
Yeah, no.
Anyway,
so 24-hour shifts in first trimester of pregnancy was tough, but I mean, we survived it.
Yeah,
just like everything else.
You're a badass.
Just like everything else, we survived it. And then I started private practice in July of that year. And
what year was this?
It was in 2016.
Okay,
so I've been in practice 6 years.
Okay.
And from there it was pretty easy.
Yeah.
His was a very eisy pregnancy. This is funny though. My labor story with him is funny.
Oh my gosh.
I was 36 weeks. So with both Isla and Fitz, I took shots every week to try to decrease my preterm labor
Right.
risk.
Right.
So I had been taking shots with Fitz, and I got to my 36-week appointment. And mind you, I've never been pregnant past 37 weeks.
Yeah.
So I'm like thinking, okay, he's coming any
Yeah.
day, right? Well, I did my Group B strep swab at 36 weeks, and then they checked my cervix.
Right.
And I was closed. My cervix was closed.
Okay.
And
wow.
I was like,
You're like, oh, I'm going all the way.
I was like, what is happening? I've never been 37
Yeah.
weeks one day. Like, this is weird.
Yeah.
And so I was like, I guess we're having a full-term baby. Like,
Yeah.
that's great. I'm
Yeah.
thrilled. So, but a little kind of like, oh, I don't know how I'm going to do this. I'm kind of tired.
Yeah.
But I was on call that weekend, and it was also a full moon called the super moon.
Oh, yeah.
Yep. So, you know where this is going, don't you?
Yeah.
So, I was on call, and I was delivering a baby at the hospital.
So you were still 36 weeks, right?
36 weeks, 6 days.
Oh, so you're like almost 37.
Almost
Okay.
37. And I'm like, it's a first-time pregnancy. I'm pushing with the patient, and
pregnant. How do you do that?
like-
You're like catching babies on your
really,
baby.
really really pregnant.
Yeah.
And every contraction that she has, I'm pushing with her, and then in between contractions, I'm having to sit down. I'm like, what is going on? Like, I'm so tired. Like, I just don't feel good.
Yeah.
And she ended up pushing for like 2 or 3 hours.
Oh,
so I'm
wow.
like, you know, standing
"Come
up,
on."
sitting down, standing up,
Yeah.
sitting down, just
I would pass
resting,
out.
resting in between contractions. And so finally delivered, you know, did the rest of the delivery, got home, and I'm just like laying around on the couch. I'm like, I just don't feel good. And I go to the bathroom, and I'm pouring blood. Yeah.
That's not funny. That's not good.
It is not good. It was scary.
Yeah. Wait, so
So-
there wasn't any on your pants? You just, right when you went to the bathroom, it came out?
So I told my husband he was home with me with the kids, and I'm like, okay, I'm just going to drive back to the hospital.
By yourself?
Yeah.
Oh,
So
my God.
I got in the car, and I was like, I'm not really hurting, but I called the hospital. I was like, hey, I'm on call, but I'm on call for my practice, which is also my doctor.
Yeah. Oh. Where was your doctor?
Yeah.
Were they out of town?
No, they were in town.
Okay.
It was fine. It was fine. But I was like, can I just put in orders on myself? Like, how
Yeah.
does this work? And they
Yeah.
were like, no, we need to call somebody else.
Okay.
I was like, okay. So I was like, I'm on my way. And so they got me checked in really quickly, and I wasn't really hurting. I was 6 to 7 centimeters. I had just during that, just the pushing portion,
Yeah.
I had progressed from probably closed to 6 to 7 centimeters.
Oh
and
my
that's
gosh.
why I was bleeding so much.
Okay. I was going to ask, so if you're bleeding, like that doesn't necessarily mean something terrible.
No.
Okay.
I mean, it can. It's definitely
Of course.
a danger
Go to-
sign.
go to
like,
the
go to the
hospital.
hospital. But
okay.
but yeah, so I was in labor.
Yeah.
I had no idea.
Oh my God.
No
Well,
idea.
That's a little nice, but
Yeah.
I'm glad you made it to the hospital.
So
But
delivered
you
him.
drove, I just thought about. Oh my God. What did Patrick think about that?
I mean, he had to get he was home with the kids.
Yeah.
They were babies.
Yeah.
So he had to wait until my mom could get there.
Oh my Lord. Mm-hmm. So you got checked right in?
Checked in, got my epidural, had a baby.
That's awesome.
Yeah.
And everything went great?
So his was a little bit harder. His heart rate kept dropping
Okay.
while I was pushing. And my doctor was requesting forceps, which is kind of the big metal spoons
Okay.
that help deliver the baby, which in an emergency is a great thing.
Okay.
And, can be considered very safe in the right hands. But I wasn't really thrilled. I probably, if he had vacuum forceps, either way, I wanted to just like push him
Of
out.
course,
You know what
of
I mean? Like I
course.
just wanted to get him out. And
Absolutely.
I was like, no. And
Yeah.
I just like pushed him really quickly.
Good.
And he came. So,
Good.
but other than that, he did great. I mean,
Yeah.
I said 36 and 6. He was 36 and 5.
Okay.
So, I mean, he came home with me too.
Yeah.
So-
Why does their heart rate drop sometimes?
Sometimes it's like a cord around the neck,
Oh.
or I have found a lot of times if your cervix changes really quickly, if everything's happening really quickly and they drop into the pelvis really fast, sometimes that can
Okay.
cause some distress.
Okay.
But
Because
who knows?
Yeah.
There's a number of things.
Yeah, because I don't think that happened with Chesta's was a pretty great delivery. I remember though, at the very end, you were kind of like, all right, I think her blood pressure was dropping.
Heart rate.
It was heart rate. Well, then I guess it was, and you were like, all right, one more big old push.
Yeah.
And I definitely had to get a episiotomy too.
Yeah.
And then she came right out.
Yeah.
But that was a little scary. And then Raylan's was pretty terrible.
Yeah.
He would not come out.
I think it's funny because I remember bits and pieces of deliveries that I've done.
Yeah. You
But
do
it's
so many. I don't know how you would.
It's almost like the hard ones. I kind of either remember, oh, it was really hard, or I kind of just like try not to remember.
Yeah.
Do you know what I mean? Like,
yeah.
If it was really hard, I remember.
Yeah.
Like Tori's, which I can talk about.
That was one of
because,
your first, right?
Yes. Tori's I can talk about because she talked about it on here. And you know all about it because you were there. But that was one of the hardest deliveries I've done. Yeah. And I was new to practice. I mean, she was my first patient that I delivered. Like not like in in private practice.
Yes.
Like the first patient that was admitted under my name that I delivered.
Right.
Because I mean, I started in July and she delivered, I think, in October. So she started seeing me as soon as I joined. Yep. And then, so that was a tough one. I'll never forget that delivery.
Well, me neither. I mean, first of all, it was so cool because, I mean, I was dating her brother, but me and her were friends, and she had already planned for me to film it, and you were the doctor. So us three being, St. Agnes girls and just connecting that way was super cool. But I mean, also, it's not about me, but thank God you were in there because you were also, you were like looking at me. You're like, Camilla, don't look. I know you. And I'm like, okay. That was really scary though. Like, you handled it like a badass. You were so calm. I mean, you saved their life. Yeah. You really did.
Yeah. I mean, that's my job.
Yeah, I know. But it's just like, wow, watching you in action. And that was my first birth ever.
That's
and
so crazy.
For some reason, I left that room. I guess, birth is just so beautiful, but that was pretty dangerous. And I left that room wanting to have a baby. It was weird.
It will do that to you.
It was
birth
weird.
In general.
Yeah.
I every day I want another baby.
I know. I'm so surprised you don't have 6 right now.
I know. Me too. Yeah. I can blame Patrick for that one.
Really?
Yes. He's like, I can't do another pregnancy with you.
Oh,
yeah.
They weren't horrible.
I mean, I complain a lot. I'm not a really happy pregnant person.
Yeah.
No, he has to listen to all the complaints.
That's
hard.
Funny.
Yeah.
I know.
Yeah.
I know. As a man, I know that's hard.
Yeah.
But he's an amazing dad.
Oh, he's the best.
He really is.
Yeah.
Yeah. I feel like he's so calm and patient.
Yes.
Does he just put on that front?
No,
I'm just kidding.
No, he absolutely is.
Yeah.
Yeah. We'll see how it goes with the teenage years.
I know. Especially
he's
with
really
a daughter, though.
He's really calm and patient with babies and toddlers.
Yeah.
And, so I'm excited to see him parent teenagers.
Yeah.
I can't wait to parent teenagers. I'm scared about it.
Yeah.
I'm worried, but that's I love teenagers.
Mm-hmm. Well, that's awesome.
I know.
That's good because usually people hate teenagers.
Yeah.
So that's good. And you have a ton of friends who have kids all around the same age, right?
Yeah.
So y'all can do it together.
Yes.
You'll never be alone doing it.
Yeah. I will say mine are pretty much the oldest of my friend group.
Okay.
Well, Declan is the oldest.
Okay.
So I feel like I've kind of always been the
front runner,
the navigator.
Yeah.
Yeah.
Okay.
Yeah.
That's how I feel too.
Yeah.
I mean, how old were you when you first had Declan?
26.
26.
Yeah.
Okay. I guess. Oh, Hank, chill. I guess I was 26 too. And I don't know if I'm just one of the first of friends to have a baby, but I'm definitely one of the first too.
Yeah.
As you know, Brittany's about to have a baby, which she told me to say, hey, hopefully she's coming close. Poor girl.
I hope so.
But anyway, so how was postpartum after Fitz?
It was great. I breastfed him for a year.
Oh, that's awesome. Let's talk about that.
Yeah.
How on earth did you do that? Because you went to work after 8 weeks?
Six weeks with him. Yep. Yeah. 14 months actually we breastfed. So that was my most successful breastfeeding journey. I was really well prepared for that one. I had read a lot about, how to be a more efficient and effective pumper and how to stay on top of that.
Yeah.
So that was good. Isla was hard. She actually got breast milk until she was a year, but she was not exclusive.
Okay.
We supplemented for her with formula because, I would pump anywhere I could find a spot at the med, bathrooms, patient rooms, like wherever I could pump with her, I would figure it out. But with him, I had a nice controlled environment, and it was a lot easier.
Good. Well, that's a long time. 14 months is a long time. So good for you.
I know.
And
I'm
doing it while you're at work.
I'm still proud.
That's hard. Pumping's real. I feel like pumping's harder than breastfeeding.
It's hard. Nursing has its own,
of
hard
course.
things.
But I feel like once you get past a slump, and then it's like much easier because you're like, oh, just pop them on the boob, and past the pain and everything.
Yes.
But then I will say one of my friends is weaning her baby off, and she's going through such a hard time because she's just in so much pain, but she's having a hard time getting like rid of her milk and stuff. And so weaning's hard too. Yeah. Mentally too. For me, oh my gosh, I came to the conclusion like my anxiety and depression was so bad after Raylan that I felt like it was only hurting me. And I could have kept doing it on my medication, but I'm so weird about it. I was like, this is going to be it. But weaning him off, like I videoed the last time, I'm like crying. I'm like, I just want to see this. Yeah. Because you work your ass off to let it go for this long. So I was 6 months and 9 days. And I will always say those 9 days.
You deserve it.
Yeah.
But what an honorable decision it was. Yeah. Because, you've got to be healthy for your babies. And mental health is important too. And so...
I'm proud of myself for making it. I did have a lot of guilt afterwards, especially when we got COVID in December. I was like, oh my gosh, I could have gone 2 more months or whatever. And then the breast milk would have been amazing for him. But I just had to I had to literally get that out of my mind or I would have, been so upset.
For sure. It's easy to try to beat ourselves up, but you have to know you're doing the best thing for you and your baby with every decision you make.
Yeah. And with Chessa, I put so much pressure on myself with breastfeeding.
Yes, I remember.
So much. It was so hard and finally gave up on it. But I'm glad I made that decision too because she just wasn't latching on. Yeah. And so this baby, I'm like, of course I still really want to do it, but I'm like, if it doesn't work out, it's okay. I have a formula that I'm confident in. Yeah. And I'll be okay.
No expectations is a great way to go into to breastfeeding because, it takes work and knowing that you're willing to do the work is important, but not being hard on yourself. Yeah.
And a lot of knowledge. Like I literally had no idea what breastfeeding even was. Like I literally thought that milk was just there and anytime the baby needed it as much as they want would just come out. But that is not the case. Like your boob's like a clock and like, I don't know, like that's a whole nother thing, but it's, I think getting help on it, doing your research and don't get overwhelmed with it, but a lactation consultant even outside of the hospital, maybe even before, I think is really important. Did you ever have one or were you just doing your own thing?
Outside. My babies were great latchers.
Oh, that's
my
good.
biggest issue was when I went back to work.
Yeah, of course.
My supply at that point. For me, I think I was the most successful for Fitz because with Declan, the whole pregnancy I was reading about pregnancy.
Right.
With Isla, the whole pregnancy I'm reading about how to be a parent.
Yeah.
And then with Fitz, I got to really focus on breastfeeding. Yeah. Like that was my goal. Yeah. With Isla, I had made it to a year, but supplemented. And so with Fitz, I was going to try to make it a year on my own. And so I just being prepared in that way and just reading about it and knowing exactly what my plan was going to be when I went back to work. That was what made the difference for me.
Yeah. Well, that is so badass you did that. Like, I can't imagine. Like, in between each patient, you're probably just pumping. And did you have, like, a little cooler?
Yeah.
That's what I brought to weddings. I had, like, a backpack and a cooler. And I had the portable pumps, though, because, at a wedding.
Those weren't out when I know. So
you had to sit down and be plugged into a wall every time?
Yeah. So I had to do it, like, every 3 hours.
Oh, man.
Yeah.
At weddings, I would do every 2 hours because this kid, he was so hungry all the time. But I would just pop them in and there's a light on it though. So like, it was like my nipples were like lit up and I told my couples, and they were like, oh, you do your thing. And like women, like and grandmas, moms, guests, like would come up to me and be like, that's amazing. Like, I'm so proud of you. And I'm like, thank you. Other people are like, what the hell?
I know. Other women are so supportive. I love it.
They should be.
Yeah.
They should be like that. We should not be judgy.
For sure.
But I do, can we talk about my situation just for a little bit?
Yeah.
Because I have a hemorrhage, right? That's what it's called.
Subchorionic hematoma.
Okay.
Or subchorionic hemorrhage.
And is that the same thing as a blood clot, right?
It's not a blood clot like what's in your blood vessels that makes you really sick.
Okay.
But it's like a collection of blood or a bruise that forms kind of near the sac of the baby. When I kind of imagine what it is, it's like when the sac grows into the uterus, you know, there's a lot of blood vessels involved.
Right.
And maybe some of those blood vessels burst and it causes a collection of blood.
Okay.
And so it can be, I mean, they can get really big.
Yeah.
I mean, I've had patients that they cover the entire circumference of the sac.
Oh, wow.
You know?
Yeah.
And it can be really big.
Yeah.
And it can increase your risk of complications.
Yeah.
But I see them all the time.
I know.
And they usually resolve.
Yeah. And I've never heard of it. I think even someone might have said it on the podcast, but it went like in one ear out the other because I had no idea what that was. And since I've found out that I've had it and it's gotten a little bigger, I've talked to some people, like, because I haven't really announced yet. Like, by the time this comes out, everyone will know. But I've just been opening up to people about it. And, oh, my gosh, I've heard so many stories, like, completely different on the spectrum. Like, one of my friends had one and it resolved itself. And
she never had any bleeding or anything?
She did have bleeding.
Okay.
And see, I have not had like the legit blood. Like I just had the dark brown stuff come out.
Which is pretty common for that type of situation.
Yes. And then like at 5 weeks, I literally felt like I was having Braxton Hicks. That would last like 30 minutes. And I was like, this is weird. I never had that with the other two. So, anyway, so I mean, that's what that was. And
a lot of times people will have them and they'll just absorb and they never even have bleeding.
Yeah. And I haven't had any more blood or anything. I have had the constant contractions and I have felt really terrible this first trimester. But today's a good day. Hopefully that's a good thing. We'll see. But anyway, and another girl I talked to last night, but this is actually kind of funny. My first boyfriend ever, his sister and I didn't get along that great. And her daughter's in Jess's class and they're best friends. Oh, isn't that funny?
My gosh.
So last night at the parent dinner, like I finally got to talk to her and we sat next to each other. And she just, obviously that was in the past.
Oh,
and
of course. I mean, what, you were a teenager?
Yes.
Yeah.
I was literally just graduated from high school. But it's just funny how that happens. I'm sure something like that's happened to you. Memphis is a small world.
Small town.
Especially private schools.
Yes.
But she had her first pregnancy and she had one that constantly grew throughout her pregnancy. 7 months bed rest.
Wow.
And her bed rest was like literally all she could do was pee and maybe shower every now and then. Yeah. But I can't imagine the mental, like your mental health during that, because she's like a go person like I am, and her husband would come home and see that like the laundry is done and he's like, what are you doing? Like, stop.
Yes.
But and then 4 months before 40 weeks she went into labor, so had to do, I guess, take medicine. I'm not sure, but to stop it. And then had a perfectly healthy, great delivery, perfectly healthy baby. But of course, how weird is that? And she just had another baby, did not have one. Yeah. So every pregnancy is different. Every baby's different.
I think it's important to say that it doesn't usually happen like that. Yeah. Like most hematomas don't change anything with the pregnancy.
Oh, okay, good.
That's a super rare complication.
Yeah, that's crazy. But of course you're just scared. And I feel like right now, like I'm doing pretty good about chilling because I'm so busy. Like I have a wedding after this, so I'll be busy all day. But I kind of feel like I'm in a waiting game of like every time I go in, I'm like, is there a heartbeat? Yeah. Because every time I've gone in, the baby's perfect. And so I'm like, it's a relief, but it's also like, oh, I'm scared. Like I don't want my body to hurt my baby. It's scary.
I understand.
Yeah.
It's hard.
I know, but we're just going to be positive and pray about it 100%. And get through it. But okay. So had some people ask some questions. I made a post saying that you were coming on and for people to ask questions. And like maybe one person commented on it and everyone messaged me personally. I don't know if they're embarrassed.
Nobody wants to put their OBGYN questions on a bulletin board.
I get it. But come on, no guys are reading it. But some of these questions, first was the membrane sweep. What is that? Does it help? Is it necessary? Let's talk about that.
That's a good question. So a membrane sweep is usually done in the last couple weeks of pregnancy prior to an induction if you haven't gone into labor on your own.
I did it twice.
The way that it works, so basically if you imagine there's a bag of water around the baby's head. If the head is down, there's a bag of water around the baby's head that if your cervix is dilated, as a provider, I can feel. So when I go to do a cervical check, I can feel the baby's head and I can feel the bag of water around the baby's head.
Okay.
So essentially what a membrane sweep is during the cervical check. So we've got fingers in the cervix and you kind of rotate them around and separate the bag of water from the cervix. So you're kind of releasing all these yummy prostaglandins that can help put you into labor.
Okay.
And releasing some of the mucus and is supposed to increase your risk of spontaneous labor within 24 hours.
Okay.
I mean, and I've seen it work.
Yeah.
A lot.
Yeah.
The risks though are it can cause your water to break,
right.
which if your water were to break, it could mean an induction,
right?
Like going in, you're not in labor and you have to go in and get induced,
right?
Or it can also probably slightly increase your risk of infection.
Yeah.
But that's a small risk.
Yeah. Do you have, I don't know if you can answer this, but do you have a lot of people turn that down or more so?
Yeah, I do. Some people are begging me for it. And some people,
that would be me.
Some people don't want it at all.
Yeah.
And the important thing is, being open with your provider, lots of communication and knowing it's your body and your baby and that's a decision you get to make.
Yeah. And I will say just like your doctor is so important. The relationship you have with your doctor is so important.
Yes.
And you have never once made me feel dumb or guilty or anything. And I have had so many friends say that they felt that way. I've even filmed a birth where, I think I told you this story, but I can't even explain to you how terrible this doctor was to the girl, like checking his watch, telling her you're not pushing fast enough. Y'all cancel my appointments, blah, blah, blah. Stuff like that. Can you imagine?
So sorry.
It's terrible. So everyone switch over to Alicia. So going into the next thing, mucus plugs. So mine came out at a wedding 5 days before Chessa was born. It was at the reception and I had so many Braxton Hicks contractions. And like I knew she was dropped. I knew it was like, it literally felt like she was like just going to fall out. But I was like, I'm going to make every wedding I can. But I went to the bathroom and there it was. And I knew what it was because I had researched it luckily or I would have probably freaked out. But I think it was just a part of it. And then maybe like the next day I was in the bathtub and I saw the rest of it like floating around. And I was like, oh, this is happening. And it did happen. I wonder if it was after the membrane sweep. I don't know. I don't remember.
Probably. I mean, a lot of times it does come out after that.
Yeah.
Because we're kind of disrupting it.
People were asking me, is it true that it can form back together once it's lost?
Yes.
Okay.
I mean, you can continue to lose it through the whole last month.
Okay.
You
Wow.
know? Yeah. With my oldest, I was 34 weeks and woke up in the middle of the night and because I told you I had been contracting a lot. And lost my mucus plug. And I kind of panicked because I was only 34 weeks. I was like, what do I need to do? And they were like, well, just, come in the morning and get checked out. And I was like, I wasn't really dilated, but I was effacing.
Okay.
But I continued to lose it every day until the day I delivered.
Wow.
I mean, every single day.
Yeah.
I would say with like subsequent pregnancies, as you lose it, it probably doesn't come back, but, or it doesn't continue.
Right.
But, I mean, it can, it can form, reform, come out, come again.
Yeah. With Raylan, he was so big and like I had so much like fluid in my body. It was so uncomfortable. But I remember sitting in the bathtub and I saw it like come out. I was like, yes, it's happening. He wasn't born until 2 weeks later and had to be induced.
Yeah.
So that's not true.
Yeah. Yeah.
Well, first, just this is like super simple, but just for those who don't know, because I feel like if someone asked me, I wouldn't know how to explain it. What is effaced? I think everyone should know what dilated is, but will you explain those two?
I wish I had a video. I know. Okay. So there's 3 components to a cervical check. The first is dilation. The second is effacement, and the third is station.
Okay.
So dilation is how open your cervix is.
Right.
And it's basically how many fingers can I get through the cervix to the head of the baby.
Right.
Usually if I can get 1 finger in, that's about 1 centimeter.
Okay.
And then 2 is like 1.5 fingers. Okay. And then 3 is like 2 fingers plus a little.
Okay.
And then so on.
Okay.
So that's dilation.
Okay.
Effacement is how thick the cervix is. So at the beginning of pregnancy, the cervix is about 4 centimeters long, and it feels like the tip of your nose, like super firm and hard. Okay. And then as you get closer to delivery, it becomes soft and starts to shorten. So if you imagine the cervix was 4 centimeters at the beginning of pregnancy, if it's 50% effaced, it's now 2 centimeters long. Okay.
And you can be that for a long time, right?
Yeah.
Yeah, I was.
Yeah, I remember.
Yeah.
And then if it's 100% effaced, it's paper thin. Okay. And so 100% effacement is like a really good indicator of labor soon. Yeah. Or you're probably in labor. Right. But like 80% effaced is super favorable. And that's, if 50% effaced is 2 centimeters long, it's, somewhere between a centimeter long and paper thin. Right. Okay. And then station. Station is where the baby's head is. Okay. So if your baby's head is like floating around and the doctor can barely reach it, then that's like -4, -3. Okay. And as you get closer into labor, it's -2, -1. And then once you're pushing, it's like 0 + 1. Right. And that's just kind of where the head is in comparison to like your spine. Right. Yeah. Okay. That's crazy. Mm-hmm.
I've seen like one of those videos. It's obviously not real, but from like the moment of conception to like the baby coming out. Have you seen that video?
And watching it like rotate through the pelvis.
Yes, that's insane. I watched that before like I had kids.
It's just such a miracle. It's so crazy.
Our bodies are amazing. Oh my gosh, I love it. Okay, and then can we talk about, because I don't even really know what this is, but I hear people doing a lot, delayed cord clamping. Yeah. Do you do that?
Yeah, absolutely. Okay. It's standard of care now. Oh, so if your doctor is not doing it, if your hospital is not doing it, then it's something that needs to be mentioned because it's an expected part of childbirth now. Okay. So delayed cord clamping is when the baby comes out and the cord connected from the placenta, which is connected to mom through the uterus, to the baby's umbilicus or belly button. That's how the baby's been getting all the blood flow through the pregnancy. So once the baby's out, we clamp the cord and then dad cuts it. Right. Dad or partner or whoever. Yeah. And then the benefits to delaying that are for baby. So decreased anemia, baby gets all those good red blood cells from mom. Okay. And so that's the benefit. It's really beneficial in preterm babies. Okay. And then there are some benefits for term babies as well.
So how long do you do that for? Because can it get dangerous?
So there is a slight increased risk of jaundice if it's too long, but that's low. Right. And then the protocol at our hospitals here in town used to be 30 seconds. Right. Now it's a minute. Okay. We'll oftentimes wait 5 minutes if baby's doing well, mom's doing well, or if the cord is pale and collapsed and it doesn't look like baby's getting much blood flow anymore, then that's a good time to cut it too. Yeah. But again, this is just something, if you want more than what the standard hospital protocol is, you communicate with your doctor. Yeah. What is not recommended though is what's called a lotus birth, in which the baby stays connected to the placenta long term.
Like when it's out of you?
Yeah.
That's weird.
And then they like keep the placenta in the bed with the baby.
I've never heard of that.
Yeah, it's actually, our hospitals don't allow it.
Okay.
But it is
kind of dangerous.
Yeah. I mean, I don't know much about it. I don't know what the risks are, but it's against our hospital policies.
Yeah. Okay. So when people have a C-section, do you do that too?
Yes, we do delayed cord clamping during a C-section. Again, 1 minute protocol.
Okay.
And then obviously partner can't cut the cord
Right.
on the sterile field.
Right.
So let's talk about pelvic floor PT.
Yes.
That's a great thing
Okay.
to talk about.
Well, at literally the moment Chess was born, you looked at me and you're like, I'm going to get you some pelvic floor therapy people. And I was like, huh? I didn't know what the heck that was.
Yeah.
So thank God you told me that.
And then you met Amy Moses and your life changed forever.
I know. And I will say this too. When I called and made the appointment, Amy is very sought after. They were like, she is booked. And I was like, well, I need you to tell her that my doctor said I can only see her. And my doctor's Alicia Wright. And so then I ended up getting an appointment with her. And after I went in there, and it was like a therapy session, honestly, she was like, thank God you're seeing me, because she really sees the traumatic kind of stuff. So thank God you got me into that. That saved me. But I will say, I mean, every birth is different and everything, but I did a lot of freaking pelvic floor therapy before Raylan was born, and I was still really rough. So, I don't know. That was all him. I don't know.
Well, I am a huge proponent of pelvic floor PT. My patients who are in labor, my nurses know. I mean, they're like, oh, this is another patient that's had pelvic floor PT, because generally labors are so much better. Yeah. Delivery so much better. And postpartum so much better. Recovery. Yeah. And then, I did not pursue pelvic floor PT until 2020. So Fitz was 4. Yeah. And I had 3 babies.
I know. It was after me. I think I saw Amy before you even saw her.
Yeah. And some pretty traumatic delivery. I mean, at least one pretty traumatic delivery. And I didn't know how bad I needed it.
I know.
That's the thing, is that I think everyone needs it.
It should be something that should be mandatory. I feel like.
Agree.
I really do. I'm glad they take insurance. They don't take all insurance, unfortunately, but they do take a lot, because it's it's physical therapy. Yeah. But I think I'm glad that you tell your patients about it, because I think it's necessary. Yeah. Because when you went in, were you just like, all right, I just want to see if I need this? Or
Yeah. I mean, I had patients that had, you learn in medical school and residency, these are the things to do for this. Yeah. And, pelvic floor PT was on a list of things to do. Right. And so I had sent patients in the past for certain issues. Yeah. Then MOJO came to town. And I was like, we have a really good pelvic floor PT program now in town. Let me give it a try. Let me just see. I've had 3 babies. Surely I've got some prolapse down there. Yeah. Surely that uterus is struggling a little bit. So maybe they can help me with that. Yeah. And it changed my life.
Good. That makes me really happy.
It changed my life.
Yeah. She's amazing. It's not only physically, it's mentally too.
Yes. Yes.
And even if you haven't had a baby, my friend Rachel, she talked about in her episode, she went to her because she was trying to get pregnant and having some problems. And she's had a lot of trauma in her life, and so that helped her a lot down there. Yep. So it can help you even if you hadn't had a baby, or
you don't have trauma.
Yeah, there you go.
And often, I didn't know the trauma that I was carrying in my pelvis. Yeah, I mean, I really didn't. I know. She just has a way of unleashing it.
She does, and she's also very spiritual, which I feel like some, I know you are too, but some doctors aren't, and some aren't. So then you kind of feel like you can't say what you really want to say or something, but I can tell her anything. Yeah. So,
and that goes for all of her PTs. I mean, Amy's amazing, but really my patients see all of them. Yes. And she just has built such a great program. So
I had Virginia on here, and she was awesome. I love her.
I did listen to that episode. I loved
she was so funny. Yeah. It was so perfect. And it was really funny too, because she was coming over, and I guess Chessa went with a grandma or something, and she goes, "Who's that?" And I was like, "That's Miss Virginia." And she goes, "Vagina." I was like, well, that's kind of,
that's ironic. Yeah.
But so pelvic floor therapy, do it. And you can do it while you're pregnant too. I think not till you're 20 weeks. And you can do it all the way to the end if you're comfortable,
Uh-huh.
if your OB says it's okay.
Yeah.
Because it can help you with preparing for labor and pushing as well.
Yeah.
It can help you know how to push or whatever.
And you can do pelvic floor PT even before 20 weeks.
Oh, you can?
It's just external. They
that's
do like
true.
external work.
Okay,
So
that's true.
that's okay.
Yeah. Well, thank you again for doing this. I do got to say is really crazy that with your pregnancies and everything, you had your babies early and they were perfectly healthy and you went home with them.
Yes. You know, I've always called myself a hot oven.
Where did you come up with that? Did you come up with that? That is so funny. But anyway, thank you. Love you. You're the best.
Love you.
Yay.
This one's for the mothers. You gotta love the mothers. And you gotta hug the ones who bring us joy and love. It's the middle with the moms and it's your day. I said now this one's for the mothers.